There are so many women who suffer unnecessarily every month, but OBGYN Dr. Jennifer Iacobelli is with us today talking a little bit more about a procedure that can help alleviate some of those challenges that too many women face. We welcome you to the show. It's nice to have you here.
Thank you.
I know that you've been in the Valley for like 35 years, so in that time you've probably seen tons of women who suffer with challenges every month.
Definitely. Heavy bleeding during periods is a huge problem in the United States. About 10 million women suffer from it.
That many, huh?
It's a large number, yes.
So tell me about this procedure, the NovaSure.
NovaSure, yes.
And what it does for us.
What the procedure does is it removes the uterine lining. The uterine lining is what builds up and sloughs off every month when a woman has her period. So essentially it removes that component so people will have lighter or no periods.
Begs the question, why would you want to do that aside from, of course, the excessive bleeding?
Well, it's a quick procedure done in the office. It can avoid hormone therapy. It can avoid hysterectomy, major surgery.
Okay, so it would be something for people considering a hysterectomy to consider as an alternative.
Definitely. I suggest women use this as a first step if they're the proper candidates for it.
Okay, and I want to talk specifically about who is a good candidate while you talk about that. Is this for somebody who still wants to have kids later?
No. You should be done with childbearing if you're going to have this procedure. Although you do need birth control, it is not considered a method of birth control.
Let's talk specifically about how this procedure works, perhaps the recovery time, and really what to expect when we talk about this.
The procedure takes about 5 minutes in the office. Treatment time is about 90 seconds. We dilate the cervix, put a wand through the cervix into the uterus. A mesh lining comes out and delivers heat to that uterine lining. That heat is what removes the uterine lining. We remove the mesh with the wand, and the procedure's done.
All said, it sounds like it's like a 5-minute in and out type of deal.
It is less than 5 minutes. It's very quick.
And so then when we go home, are there any side effects or symptoms or a recovery that we should kind of anticipate?
Good question. Usually people are feeling good 24 to 48 hours later. You may have some mild symptoms like nausea, vomiting, cramping, bleeding, discharge, but only a small percentage of women will have these side effects.
When you think about hysterectomies and this being at least a first step, if not an alternative to hysterectomy, in my mind I kind of think of a woman that's menopausal. What are the age parameters for this, and who are the women that are actually having this procedure?
We provide the procedure in all age ranges. I have seen women in their 30s that are struggling with heavy painful periods that know they're done childbearing. I have also seen women up to almost menopausal age have the procedure done that have struggled for years with irregular and heavy periods.
What's the likelihood of, after having this procedure done, having the recurrence of your cycle?
If your goal is not to have cycles, then you're setting yourself up for a little bit of disaster because that's not the intended goal. Most women will have lighter, shorter periods with less cramping, and some women will have no periods. The satisfaction rate is about 9 out of 10 women.
Those are good numbers. Those are very good numbers.
Those are good numbers, I agree.
Well, let me ask you this, too. A lot of times people, when you talk about something that maybe they haven't heard of, maybe they haven't heard of NovaSure, they think, well, I don't want to do something that's new. I'll wait a while. Is this new, or has it been around?
We have been providing the procedure for years now.
And with great results and
fantastic results.
FDA
yes.
approval and such.
Exactly.
What are some things that you would suggest that patients consider before they even set up a consultation? What are some questions we should ask ourselves?
Well, is your period bad enough to the point where it interferes with life? Does it make you miserable? Is it inconvenient for you? If those answers are yes, then you are a good candidate. Are you done having children? That's the big one.
Those are the big ones. I want to take this last couple moments that we have together to talk about the practice. Goodman Partridge, if you've lived in the Valley for any length of time, they've been here for like more than 3 decades.
Exactly, 34 years.
So, and you have offices that are available all over the Valley, precisely because your patient list has grown and grown and grown.
Exactly. We have 5 locations currently: Chandler, Gilbert, Mesa, Maricopa, and we're opening an office in Queen Creek soon.
You're growing and growing. Next thing you know, you'll be Scottsdale, Avondale, Glendale.
Everywhere.
Well, we appreciate you coming in and sharing with us a little bit about this procedure, the NovaSure. And we're going to provide some information for anybody who would like to get a little bit more one-on-one information. Doctors Goodman and Partridge have 5 Valley locations, as you just heard the doctor mention. You're going to find them in Maricopa, Chandler, Gilbert, Mesa, and then there's one opening in Queen Creek soon. The number on the screen is the best way to make your appointment for that consultation, 480-821-3616, and more information is available online at azmomdocs.com. Lastly, Doctors Goodman and Partridge are sponsors of Sonoran Living Live.